All right, welcome to episode 20 of the Beasley Equine podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. Episode 20, we're on the way to 100, which we're 20% of the way to being good, according to science. So we got a lot to talk about today. We're going to talk to you about what we've been celebrating here in Southern Illinois and especially at the clinic. We're going to talk to you about an unfortunate EIA outbreak of infectious equine anemia and the precautions we can take and what that means for horse owners. So stay tuned. Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin. All right, we got a lot of exciting things coming up. We are very blessed and fortunate to be in the position where the podcast itself has decided to sponsor some youth rodeo kids, and we've got 8 we handpicked this year. We didn't let them know. We just kind of surprised them with a letter. They're getting a lot of perks, and one of the things they're going to do is join our podcast. So we're going to sit down with these youth rodeo kids and pick their brain a little bit, and we got those coming up. I think we start those interviews tomorrow, so stay tuned as we air those throughout the rest of the season. And you can support us by subscribing, liking these things, watching them on YouTube, telling your friends, and help us support the future of the equine industry too. And also tomorrow, I get to sit down with a PhD nutritionist from Purina, Dr. Masa Williams. I hope I'm saying her first name right. Purina comes in periodically to update us on some of their new research, and we have a really good relationship with them. And they leaped at the opportunity to join us for a podcast. So we're very excited about that. And for those of you watching us on YouTube, you'll see a new addition to the back wall back there. Many of you know my Roman passed away a few weeks ago, and John and Hannah and Autumn gave me this picture of Roman as a Roman soldier. And it makes me smile. And last week was the RSNC World Finals of the team sorting, and we have a champion here at the clinic, the future Dr. Jenny Buchanan and Tommy Perkins. Both of our clients won the graduated rookie class and got to bring home a pretty good check, a big shiny belt buckle, and I think Jenny said she gets a jacket. We're going to sit down with them in the next few weeks and talk about their journey through the sorting and their horses and what it was like at finals and what it was like to sit in that winner's circle. And a couple other clients, Bill Womack and Elaine Jackson, won the Masters number 10 handicap. And I think Elaine also got a big, beautiful saddle for a year-end thing we're going to ask her about. And I'm hoping she brings the saddle to the podcast because I've seen pictures and it looks absolutely amazing. And I also want to take this minute to thank one of our sponsors, Protect GI. You can protect your horses from ulcers with Protect GI. If you want to keep your equine partner thriving, Protect GI from Calado is your go-to supplement for total digestive health. It's backed by science, and it reduces gastric ulcers and supports both foregut and hindgut health, and it's perfect for any horse, but especially those that are prone to GI upset. I know Jenny kept her horse on it throughout the finals. And as you listeners, you get a special perk. You can save 5% on Protect GI today. Just use the code BEC at checkout on Calado.us. That's KELATO.US, code BEC for 5% off. So keep your horses happy and healthy with Protect GI. And click the link in the show notes for their website and the promo code. So we've had a lot of phone calls lately, a lot of questions and concerns about an EIA outbreak, which is equine infectious anemia. And that is what the Coggins test tests for. We look for carriers of that. So this happened late last year at a large veterinary clinic in Texas called Outlaw Equine. And the way this is transmitted is either it's blood to blood from horse. The main way it's transmitted is biting insects like deer flies, horse flies, house flies, mosquitoes, etc. But also we can transmit it what we call iatrogenically, meaning people caused it, either reusing needles from an infected horse to one that's not. And we are unsure of the impact of this yet, because this was a very large facility with a large number of horses that came through there. And I don't think we know exactly what horses have been possibly exposed and where they went. So it's a bit of a nightmare right now. And I think there was 2 horses in Colorado, in 2 different counties that tested positive that were euthanized in April of this year. And the investigation's ongoing, and it's very difficult to track these exposed animals. So I told a client earlier, it's a shit stain on the veterinary profession that this happened, especially at a clinic of this size. And it shows it's a lesson learned. It shows us how quickly this disease can spread. So what is this disease? EIA, equine infectious anemia. I think the old timers called it swamp fever. It can affect all equids, horses, ponies, mules, donkeys, even zebras. It's caused from a retrovirus. It's similar to HIV. If people ask me what it is, a lot of times I'll tell them it's kind of like equine AIDS. The good news is it's not transmittable to humans. A lot of the stuff, the last episode we talked about rabies that we can contract, West Nile, stuff like that. We do not get EIA, but it's devastating to horses and the whole industry. Symptoms of it, they can get a fever, anemia, of course. That's part of the name, equine infectious anemia, weight loss, lethargy, swelling, and sudden death. One of the issues with this is many horses are what we call asymptomatic carriers, meaning they show no symptoms of it, but they carry it and can transmit it to other horses. And they can spread that virus unknowingly. And there's no vaccine for it, and there's no cure. And infected horses are lifelong carriers. So how is it spread? Blood-to-blood contact. The main vector is biting insects. Like I said earlier, horse flies, deer flies. If you're in Southern Illinois and you've been outside lately, you know the insects are absolutely terrible. If you've ever spent time in Texas, you know about the insects down there. They're even worse. And then the iatrogenic or human causes, reused needles, contaminated equipment, untested blood transfusion. If a horse needs a blood transfusion and the donor horse has it, you can give it to the recipient. At the Outlaw Equine, from the reports I'm hearing, they said it was from a contaminated flush container, which the flush is what we use to flush. If we put an IV catheter in a horse, we have to flush those so often, otherwise the blood can get in there and clot. How they got blood on the needle with the flushing, if they were using proper technique and an extension set, I'm still trying to wrap my mind around how it happened, but it does highlight the importance of basic biosecurity in clinics and barns. Most of the time, an outbreak like this takes place from somebody using the same needle for certain things, trainers, owners, but unfortunately this time it was at a veterinary hospital. So most of you have had a Coggins test on your horse. That name comes from Dr. Leroy Coggins. I think in the 1970s, he was the one that developed the test, and it tests for antibodies to that virus. There's a couple different tests they can do, the AGID or the ELISA. And the reason we do testing like this, especially yearly on horses, sometimes even more, is to detect carriers, especially the ones that aren't symptomatic. And a lot of places require this before interstate travel. To write a health paper, we have to have a negative Coggins. Most of them are valid for 12 months. Like I said, sometimes 6 months. Sometimes we want, depending on outbreaks and where they're going, sometimes a negative Coggins within the past 2 or 3 months. If we get a positive, a couple things can happen. One, we euthanize the animal, which happens most of the time, or the rest of that horse's life, they're in quarantine by themselves, at least, I think it's 200 yards from any other horse or mule or whatever. The reason for that 200 yards is because the main vector of this is insects, and there's only so far they travel. So they feel that the 200 yards is safe, but what kind of life is that if your horse is by itself And then most of them will get symptoms, and they do have to be humanely put down. So that's why testing is so important in these. The United States relies on the mandatory testing and reporting. So the annual, we can prevent or catch carriers early and protect the bigger herds of horses. So a lot of the questions I've been getting earlier about preventing, what do we do? How can we do it? There's not much you can do if you're in the vicinity of a positive horse, except hopefully control the insects. And obviously don't reuse needles. You should never do that anyways. Fly control, fans, fly spray, anything where flies would be attracted to, like standing water, disinfecting equipment properly. We do reuse surgical equipment, like our emasculators. We disinfect those every time. And then if there's anything out of the ordinary, of course, call your vet. So regarding this outbreak, I mean, I think it's a huge wake-up call for the horse community and a call for us to stay proactive with testing for coggins and biosecurity and people putting on shows. If you got a lot of horses coming in, check those coggins. I know it's a pain in the butt, but just we got to do everything we can, because the finals coming up in a couple weeks I think it's Little Britches, so it's stuff these kids have worked all year for, and it would be devastating if they went out there and their horse got it, and it would be devastating if they had to stay home because of the risk, or devastating if they had to cancel or postpone the show, which may be the safest thing to do. We don't know. But again, there's insect control. That's about it. We still don't know how many horses potentially got exposed or could have been exposed and where they went. I think we're going to learn a lot in the next few months as the USDA tries to track all this down.
I'm looking at something now, and they're starting to put together a list. There's 22 known horses that have been put down so far, but
euthanized.
Yes, but the amount of horses that have come in contact with, they still aren't sure. Right now, Outlaw Equine's putting together a list of all horses that were in the ICU, because supposedly the outbreak was contained in the ICU only. From what they're saying,
as far as the iatrogenic spread,
but at least one, it looks like they euthanized 21 horses directly from them causing it. The 22nd horse was from another horse.
Yeah.
And so it's starting to go beyond what they did. And the 22nd horse was at their clinic at the time.
Okay.
And so it is spreading from horse to horse as well, from horses that they actually gave it to. Then what type of liability does Outlaw have in this?
I don't know.
I mean, are they?
I don't know. In Texas, every state has different laws as far as what you can do. I do know in one of the USDA reports that and it's on their website too, that the ICU coordinator was an unlicensed vet tech, and there's nothing wrong with that. But looking at, and it's perfectly legal in Texas, but looking at a hospital that size, not to have somebody that may have, and not so much just the training, but the what am I trying to say? The license behind their name and the accountability. I mean, we don't know. I've talked to several vets. Like, what are you telling people? What are we doing? It's everybody's throwing their hands up in the air. So I don't know. I think we're going to be dealing with this at least the rest of the year. And I think we're going to have stuff pop up for years to come.
Especially the amount of high dollar horses. I mean, I know of a couple of mares that were very big and very good and well known in the barrel horse world that were soon to become real high dollar brood mares to some good babies, and they're gone. They had to be euthanized. Those are gone.
And
that bloodline's gone.
Yeah. And I mean, we have a lot of horses in Southern Illinois, but nothing like the concentrations in Texas. So, I mean, one horse going to one breeding farm or another hospital that may have 300 recips, and the recips may go wherever these people are from. I don't know. I don't know what to tell anybody. Time will tell, and we're just going to have to figure it out. I know the USDA is doing a really good job at trying to keep us informed. The AAEP is doing a good job, and hopefully Outlaw is cooperating, as they say. We'll see. So any updates, we'll try to keep you guys posted. But until next time, like I say, take care of your horses and yourself.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.